Okay, it's January 4th, and we're talking to patient Carla, who is now 5 months status post osteobunionectomy of the left foot. And she's here today for her fixation removal. She has a SafetyFix screw in her first metatarsal, and she's doing really, really well. We're going to ask her some questions about how she's doing. But of course, the first thing we do is we just palpate the screw head, and I've already asked her these questions once, so I know what her answers are going to be. This right here, no difference in sensation between here, here, and here. What I'm doing is palpating right over the screw head. I'm putting pressure on the screw head, and she doesn't feel anything. There's no pressure, there's no trophic changes, but yet I can palpate the screw head here. We can go proximal, push, distal, push, no pain. She's also got very little edema. She tells me she's been running, which is phenomenal, and her range of motion is great. So she's got great function. She is a keloid former, so she's got a mild hypertrophic scar here, which I'll address intraoperatively with a little cortisone injection when I take the screw out. So we're going to ask you some questions. Okay. First of all, your experience after your surgery. We know usually patients take about a month to sort of take it easy, and then at that point I allow you to get back into your tennis shoes. Tell me what your experience was from about that point, or the point that you got into your tennis shoes on. Tell me what your activity level is, what your professional level is, all that kind of stuff about your life. Give viewers an understanding of the road testing that you did with this.
Sure. Well, I lead a very, very busy life, and so I was instantaneously able to put my shoes on and get to walking, have very limited pain. I'm a full-time graduate student at Washington University. I walk throughout the campus. I'm also an internist at Hazelwood East High. I was able to walk as if nothing had ever happened, so I haven't felt much pain since the initial 4-week process was over.
Great. And swelling-wise, were you able to get into your shoes pretty well?
Yes, I was, with minimal swelling.
Excellent. So running.
Yeah.
What kind of an exercise fanatic are you, or person are you?
So I ran track for 17 years.
Wow.
Yeah, so I was accustomed to having a regular regimen of exercise and lifting. And so I haven't lifted as much, but I have been able to run since about 4 months in. I've been able to run about 1.5 miles a day and not feel any pain. And so I'm really excited about having the screw removed so I can get back to my 3-mile-a-day regimen.
Super. The screw removal, as you know, is going to be very easy. We're going to do the tiniest of incisions. I'm going to try to keep it at under 5 millimeters.
Okay.
And that should be it should be very easy to take out because I palpate it right under the skin. Okay. And you're going to have my permission once you remove it to pursue any activity you want.
I'm looking forward to that. Thank you so much.
Very good. So palpation of the screw head right here is easy. We marked it with a little marker, and now all I'm doing is I'm taking what appears to be about a 3 millimeter incision, and I'm stretching the skin and I'm using the elasticity of the skin to make the incision large enough to be able to come right over the screw head. So this stretching of the skin does no harm. It just uses the elasticity of the skin to allow for the driver to get in through the tiniest of incisions. So we're just stretching out the skin a little bit, and I can already feel the screw head right here, right there. So I know I'm right on top of it. So all we have to do now is just put the driver in. And you hold the driver like a pencil, and as you can see now, we can get the driver right in over the screw head. And you can even do part of your dissection is just simply getting the driver in and positioning it over the screw head. Once you lock the driver in to the screw, you won't be able to turn it anymore. And the next step is to just basically go to the top of the handle. Do you see that move? So that move is essentially, here I am holding this driver like a pencil. Now what I want to do is keep the driver in this position, and I'm going to climb the driver. We'll call this climbing the driver. Boom, boom. And now I'm able to put some downward pressure on the driver to get the screw, to purchase the screw head so that we can start advancing the screw out of the wound. And now I've got the perfect angle, and it's all about just allowing that screw to come out. Like any excision of any screw, whether it's through bone or wood, you just allow the driver to do the work after a while, and you'll see how easy it is. So there's the screw, through the wound. And so what we're able to do here is take out a screw that's a 2.5 screw, 16 millimeter screw, through an incision that's no bigger than about 5 millimeters, 6 millimeters stretched, and that'll shrink back down to about a 4 millimeter excision point. One stitch, or even in this case, a steri strip, and she's all ready to go. It's January 10th, and we're seeing patient Carla, who's 6 days status post removal of the SafetyFix bone screws. So she had a screw removed from the Austin bunionectomy, and we're going to remove the suture, but we're just going to ask you a few questions about your experience with the removal. Since we've already got some questions that we've asked about your previous experience, we may repeat those questions also, but tell us your experience with the removal process.
Sure. Well, it was a very successful process. I didn't have any pain. I haven't used any pain medicine. And I was actually able to go to Zumba class last night, and I didn't have any pain with that, so it's been successful.
Great. So 5 days after excision of hardware, you're in Zumba.
Yeah, I feel like I'm back to my normal self.
You probably could have gotten back even earlier.
Oh, wow.
Yeah, I mean, literally, I've had patients hike a couple days after the excision process, so that's excellent. So once again, we're going to remove that suture today, and everything looks great. Your x-rays look great, and as you can see, the only thing we're looking at here is where hardware used to be in your foot. So that's great. But once again, let's reiterate your experience, because you were running on your foot with the hardware in, and you do have a history of being a distance. Was it a distance runner or a sprinter?
Short, yeah, a short distance runner.
Okay.